to an exciting episode where we dive into the inspiring journey of a remarkable doctor who recently passed his residency exam here in Memfys Hospital. Join us as we explore his experiences, the challenges he faced, and the triumphs that shaped his medical career. Get ready for some insightful stories, a few laughs, and a glimpse into the world of healthcare through the eyes of a dedicated professional. Let's jump right in and hear what he has to share. Hello viewers, my name is Uche. We are live here in Memfys. May we know who you are?
My name is Dr Nwabueze a resident who has just completed his program here in Memfys Hospital.
Okay, so what brought you to Memfys?
I came to Memfys Hospital for the second part of the neurosurgery program completion. Neurosurgery Part 2, my neurosurgery Part 2 program was what brought me here.
Okay, so sir, please, can you tell us, how was your experience in Memfys? Can you share with us how was Memfys when you were here doing your training and all?
Okay, the training in Part 2 is usually like a minimum of 4 years. So I spent within that time here, I've encountered a number of cases, had interactions with both patients, relatives, and the community, Enugu community at large. It was a beautiful experience, and I will thank God that eventually it has come to an end.
Okay, thank you very much, sir. So during your training here in Memfys, how was it like? How is the neurosurgery residency training like here in Memfys? Can you tell the viewers how the experience was like? What did you encounter? How was it? Can you share with us?
So basically, it's a well-structured training program where there are different you have to go through different aspects of training in neurosurgery. You have to do general neurosurgery, neuroradiology, neuropathology, different aspects of the neurosurgery profession has to be well. You have to get training in the various aspects. With respect to the program here, it's a very robust program. And you get to encounter various cases to furnish you with enough knowledge to be able to perform maximally or efficiently in any of these cases when you get to see them. So the program here is generally a very well-structured program that is efficient enough to give that robust training for residents in Part 2.
Can you tell us, is Memfys Hospital accredited to train neurosurgery residents? And can you tell us the college that gave them approval?
With respect to training of Part 2 residents in neurosurgery, there are basically two colleges. You have the West African College of Surgeons, the National College of Surgeons. Both of them have very strict criteria about how much they require, their minimum requirements before you can be given the honor of getting their accreditation. Interestingly, in 2019 when I came here, Memfys was among the elite group of hospitals that had double accreditation, meaning you could train a resident either in West African College or a National College. So it's actually a good pointer to the fact that it was a very well-equipped hospital.
In other words, you can sit for Part 2 final examination in any of the colleges you mentioned, right?
Precisely. So being that we are fully accredited by both colleges, it means that at the end of training, you are eligible to take in either of the colleges you are registered for.
Okay, thank you very much, sir. Just after this, we would like to know, how tough and difficult is training here in Memfys Hospital compared to other hospitals here in Nigeria, or let's say here in Enugu, if there is any? Because you mentioned about national and Western examinations after your training, right?
Yes.
So how tough and difficult, how can you compare Memfys Hospital to other hospitals, please?
All right, thank you. That's a very interesting question. Every training center has its peculiarities, okay? The one peculiarity about Memfys Hospital is that it's a private hospital. Of course, being a private hospital means that the premium that is placed on the care of the patient is at a much higher level than compared to a public hospital. So naturally, there's a little bit more pressure here. The pressure to perform and make sure that things are done right, they're a little bit higher than when you compare to what you get in the public hospital. Another peculiarity that you find here is that because it's a private system, things run a little bit more efficiently here.
Yes.
the investigations get done quickly.
Yeah.
Any request you make gets attended to. Surgical scheduling, when you have emergencies are promptly taken, elective surgeries are not unnecessarily deferred. So those are like the peculiarities compared to a public hospital where we know that there's more pressure, where there are some pressures. When it comes to surgical scheduling, it's difficult to get surgical scheduling, and then the efficiency of the system is not as efficient compared to a private hospital. So those are the peculiarities of training in a private sector.
We would like to know, can we know your trainers, your senior colleagues here in Memfys Hospital, the role they played and the relationship you shared with them? Do you think you shared a cordial relationship with them?
Thank you very much for that question. Interestingly, we have a hierarchy of very senior colleagues here that are very key to our training here. The most senior being the Emeritus Professor Sam Ohebulam, who is the founder of the hospital and is the main backbone for the hospital. Other senior members of faculty that we find here include Professor Mezwe, one of the most senior one of the first trainees from Emeritus Professor.
He was trained here in Memphis?
Not necessarily here, but he was trained by Professor Ohebulam too.
Okay.
We also have Professor Ndubisi and then Dr. Okunodulu, who is also our Director of Training. Okay. Very much key in doing a lot of the groundwork with respect to training, the day-to-day training of the residents. We also have an expanded faculty because interestingly, this center has been able to train close to like 15 to 20 other neurosurgeons. So those ones also participate. They are all widespread in all parts of the world. Yeah. Those also play their own role, their own various roles when it comes to the mentorship program here for the residents. With respect to whether my relationship was cordial with them, I think they are in the best position to say that I tried my best to perform my roles as a resident here. I tried to do my work as I could and had good relationship as far as to my own perspective. So to verify that, they will have to give their own perspective.
All right, Dr. Uche, please can you tell us which exam did you sit for after your training here in Memphis, and what was the outcome?
I sat for the West African College of Surgeon Examination Part 2 in Neurosurgery, October, which was just a couple of days or weeks ago. And as you can see, that's why we're having this interview. I think I was successful in the exams. Thanks be to God.
Congratulations to you.
Thank you very much. Thank you very much.
All right, so what were the common neurosurgery cases you saw here in Memphis and the most challenging cases you saw here in Memphis during your training here in Memphis?
All right, so the spread of cases I got to see here was a quite good spread of cases. We had some trauma cases, some pediatric neurosurgery. But however, a good chunk of the cases I saw here were more of a neuro-oncology, where we deal with a lot of tumors in various parts of the brain, whether the anterior, medial, or posterior cranial fossa. So a wide range of tumors. Also spinal tumors also. Then vascular neurosurgery. One of the things that I think the hospital can be very proud of is compared to other hospitals doing neurosurgery, vascular neurosurgery numbers are much higher than the ones other people do. Clipping of aneurysms, when you check our register, we're at a much higher, we seem to have done a lot of more cases compared to when you compare to other centers. So it's a beautiful spread of cases. Okay? In terms of the challenging ones, of course, tumors, depending on whichever part of the brain you find, can be depending on the size. So there are like multiple cases. I wish I could tell you I have one or two. So each case comes with its own peculiarities and challenges. But I guess the whole point of training is to learn how to tease out these challenges and then home in on how to get the problem solved.
What is the success rate of patient recovery right here in Memphis after successful surgery?
Well, the success rate of neurosurgery depends on the case and depends on the peculiarities that come with the case. But overall, we get a very high level of patient satisfaction. And that high level of patient satisfaction drives from the fact that it's a very efficient system where investigations are done when they're supposed to be done. Surgeries are scheduled when they ought to be scheduled, and then even when complications arise, the mechanism for us for handling those complications are very robust in the hospital. So, given on a broad scale, I'll say we do have very good success rates for our surgeries here.
Okay, sir. Thank you very much, sir. So I would like to know again, have you encountered any impossible case here in Memphis that your senior colleagues could do nothing about? Can you share your experience if you've encountered such stuff?
Okay, yeah, that's a good one. Neurosurgery has its peculiarities, and so depending on the part of the brain that is involved, there are actually cases where there are some technical nuances which we do not have the capacity to do. Like currently in Nigeria, I'm not aware of any facility where they do coiling of aneurysms. So once in a while, we get those rare cases where you have multiple aneurysms in a patient with a good neurological status that will benefit more from coiling than clipping. So that's the closest I can put to impossible. Impossible, not that we cannot do, but the technical nuances for those cases are not available within the country. We do not have those facilities. What we usually do for those cases is we stabilize them, and then we refer them to centers where usually outside the country where those surgeries can be carried out.
Okay, thank you very much, sir. So, sir, please, what's your patients' feedback after their stay here in Memphis? Was it positive? Was it negative? Can you share with us?
Okay, so thank you very much. The overwhelming percentage of responses were usually very friendly ones. Occasionally, you get one or two patients that are unsatisfied about their care, but if you put it on a scale, we have like the overall response we get from our patients. We get a lot of patients who are satisfied with the level of care they've been given here. By and large, I think I've gotten a lot of good responses. That you have patients here who pray for you, who are very satisfied that rather than gathering money to go abroad, they're able to access the same technical surgeries or the same services are being obtained here in Nigeria. So those ones are very grateful for that opportunity.
What is your advice to other young doctors who may or may not consider specializing in neurosurgery?
My advice to them is neurosurgery is a peculiar subspecialty. So if you do really have a passion for the nervous tissue, that's the brain and the spinal cord, and you like the surgical aspect, it's a beautiful field to specialize in. But you should be ready you require a lot of mental strength. Your ability to persevere. Our surgeries are long hours. You spend the long hours in theater, so you must.
From what hour to hour?
Our surgeries could be as short as 3 hours, but 1 hour. But the really long ones can go as much as 18, 19, 13 hours. Wow. Yes. So it's a high stamina field. You need that strength.
You need to eat well.
Yes. So for those who want to consider it as a career choice, if you have the passion, no doubt you'll be able to surmount the challenges. Just like every subspecialty, it has its own share of challenges, but it's rewarding, and the impact you have to the societies, it can't be measured at all. It gives you a great deal of satisfaction from a personal level. Yeah.
Okay, so you're advising the young doctors coming up, if they have a keen interest in nervous system, they can go into it, right?
Yes, it's a beautiful field to come into.
Thank you very much, sir. Just on a final note, can you tell us what makes Memfys Hospital stand out for training neurosurgery residents?
The hospital stands out because of a lot of factors. One, I think the main factor here is that it's a private system. Private gives it a lot of efficiency. It allows everything to be done clockwork. Investigations are ordered for; you get them at very quick notice, which you don't get elsewhere.
Yes.
The key investigation modalities are here. You have a brain MRI, both 1.5 Tesla, 0.35 Tesla. We have up to about 2 functional brain CTs here. So all these things they help when all these gadgets are available. They assist to make timely interventions for patients. And being that it's a neurosurgery focused hospital, there's no distraction.
Okay.
In a teaching hospital, you can have a general surgeon or a cardiothoracic surgeon. They are both struggling for very few available theater spaces. But here in Memphis Hospital, it's just neurosurgery. So all the energy, resources are all focused on getting both the neurology or the neurosurgical patients into to make them to get them better. So that brings a lot of efficiency into the system. The residency structure is almost it's about 20 years plus years old. So it's well structured with a lot of tradition. The pass rate is very good. That's another key thing about it. They have a very good pass rate for the residents who come here for training. So all this put together makes it a very lovely hospital where training for Part 2 neurosurgery candidates should take place. Now, of course, I would be lying if every system has its fair share of challenges. So just like every hospital, it has its own peculiar challenges too. But on the balance of scale, it's still a fairly efficient system where residents can do Part 2 neurosurgery training.
Thanks for joining us in this insightful conversation with our incredible doctor. We hope you enjoyed this section and found inspiration in his journey. Stay tuned for more stories that highlight the dedication and passion within the healthcare community. Until next time.